Chairman, so far the federal government has invested $30 billion in electronic health records, in part because sharing health information between doctors can improve patient care. But it's still the case that the health record systems can't always match a particular scan or test result to the right person, and mismatches can be very dangerous. As more patient information is stored electronically and as doctors exchange more health records with other doctors, the risk of mismatching patient information goes up. So we've got at least 2 studies that I know about on this. A 2008 RAND Corporation study estimated that even with database management software and personnel that were dedicated to preventing such mistakes, hospitals mismatch patient information about 8% of the time. A 2012 study conducted by the Council of Health Information Management Executives found that 1 in 5 physicians encountered mismatched information that put a patient at risk during the previous years. So I would like to start. Mr. Richardville, can you explain to us what tools Carolina's healthcare used to solve this problem?
Yes, CHS on many pieces are on the forefront of innovation, and what we looked at several years ago and was the first actually to bring into the country was a biometric palm vein scanning system. So it actually scans the veins in the palm. It's not a palm print, but it's the veins like a snowflake in the palm. We have that at all of our locations. We've had that for many years, and since then, when you quantify like the 8%, our medical record number duplicate or error rate is 0.11, which is 80 times better than the average that you talked about. So at least within our system, we've been able to mitigate that issue. Now, as we try to match across the systems, I'm not saying that that is the answer for others, but I think there's probably other successes in the country, and we need to put those heads together and see if there is a way that we can expand that across.
So let me ask the question about then among systems. Mr. Patterson, in your written testimony, you discussed Commonwealth, an alliance of health IT companies that connects health records that are managed by different vendors. So what has Commonwealth done to avoid the mismatches? Now we've got the between systems here.
So Commonwealth, in broad terms, Commonwealth allows you to create an account that is used for, and you as an individual create it. You say, here's what consent I give to share my information, and here is my identification. So it's like having your email, having your Google email account. So, and you're controlling that account as the person.
So this is done patient by patient.
Patient by patient at enrollment. And once you have that account, obviously to start your first email account, there's a process to it, but once you have your identification, then information can be sent and moved. So Commonwealth has solved the identification problem on a voluntary basis. Craig's solution is much more precise and elegant, but I do not think we can implement that nationally. I'm not going to, you'll have to have a hearing on that.
Sure.
So that's much more precise, but also Commonwealth basically provides the software. There's a number, we have near 30 members of Commonwealth. All of us as software companies agree to also, when we record the fact that there is information about a person under that ID in our records at these locations. So we solve the record location issue too.
Okay, so Carolina's Healthcare and Commonwealth and others around the country are all working to prevent patient matching errors within their own systems, but there are obviously limitations on what you can do alone. So, Mr. Patterson, I'd like to ask you, what can Congress or the Office of the National Coordinator of Health IT do to help scale individual efforts to reduce matching errors and at the same time to protect patient privacy?
The ability to have an identifier that we all share would be an enormous help in reducing the risk and improving the value to patients. If it were possible for it to be simple to do and accurate, then it would happen more often. And I think patients would benefit enormously from that. In the absence of such an identifier, algorithms that help us do the next best thing, which is use existing information to make sure that we know who the person is when the information is sent or received, would also be very helpful. And much work has already been conducted in this arena. It is a complex and very important question, and I'm glad that you're focusing on it. We also have people who come to us in our trauma center who are unconscious, unable to tell us who they are. And it is a risk to them and requires enormous effort on the part of our staff to be sure we know who this is as we provide care to them in the safest way we can.
Good, thank you. You know, accurately matching health information to the correct patient record is critical for the safety and the effectiveness of electronic health records. And I look forward to seeing more research in this area. I hope that industry and government can work together to find a solution that keeps patients safe and that protects their private health information. Thank you very much. Thank you, Mr. Chairman.